Sometimes, when studying for a degree, the mathematics within that degree can cause problems, particularly if you haven't studied any mathematics for a while. In this video, we will show you a technique that has been designed to help you overcome the challenges faced when tackling the mathematics on your course. This technique is called self-explanation training. Self-explanation training has been shown to significantly improve students' understanding on a range of subjects, and not just mathematics. When you are studying the mathematics in your course, there are 3 key steps you need to make sure you do. 1. Try to identify and elaborate on the main ideas used. What are the main ideas? What are these ideas telling us? Why do we need them? How does it help us to solve the problem? 2. Attempt to explain the mathematics presented to you in terms of previous ideas. This could be information from within the question, examples of previous ideas or questions, or it could be information from your own prior knowledge of a particular topic area. 3. If something in the question contradicts your current understanding, then you should question it. What has contradicted your understanding? Why has it contradicted your understanding? To help ensure you complete the 3 key steps, you should ask yourself the following. 1. Do I understand the ideas used in that question? 2. Do I understand why that idea has been used? 3. How does this idea link to other ideas in the topic area or other mathematics or prior knowledge that I may have? 4. Does the self-explanation I have generated help to answer the question that I am asking? Here is now an example of a typical question you may face and how a student used self-explanations to help them understand it. When reading this question, the student made the following self-explanations using the steps described previously. 1. This question is about drug calculations. 2. The age and weight of the patient has nothing to do with the calculations, as there is no information telling us the drug is prescribed based on weight or age. 3. To calculate the volume required, I need to use the formula dose required over dose in stock times volume of medicine over 1. 4. All the units are the same. We want milligrams, and stock is given in milligrams, so no conversions are required. 5. The dose required is 240 milligrams. The stock dose is 120 milligrams, and the volume it is given in is 5 milliliters. 6. Thus we need to give the patient 240 over 120 times 5 over 1, which equals 2 times 5, which equals 10 milligrams. There are 2 methods that may appear to be self-explanations, but actually are not, that you must look out for and not do. These methods are paraphrasing and making monitoring statements. An example of paraphrasing in the example question would be 240 milligrams needs to be given from a medicine stocked at 120 milligrams per 5 milliliters. Here the student has simply shortened the question. There is no self-explanation here, as nothing is linked or added. An example of monitoring would be, okay, I understand the answer needs to be in milligrams. Again, this is not self-explanation. It simply shows the students' thought processes and no additional information is added or linked. An alternative self-explanation of the same statement would be, okay, the final answer will need to be in milligrams because the stock strength given in the question is in milligrams. Notice how in this alternative version, the student identifies the main idea and elaborates on it. This provides the student with a greater understanding and is the approach you should take after reading every question or example of mathematics in your course that you face. Here is now a practice question for you to look at and use the training that you have just been given to help you understand the question and what mathematics and mathematical methods you will need in order to answer it. You can do this in your head or make notes. Question 1. A patient is to receive IV fluids over 8 hours. What percentage would be administered after 6 hours? Question 2. A baby is to be fed 7.5 milliliters every 3 hours, a mixture containing milk and medicine. How much in total per day is this in microliters? Question 3. A patient aged 25 years old requires a medicine that is kept in stock of 25,000 units per milliliter. If the dosage required is 400 units per day per years alive, what is the volume of medicine that this patient requires?